Hi there, I'm Jamie, and I have an Indiana pouch. My pouch is about 9 years old, and it works exactly as was intended to work. I have no leaking. I catheterize 5 to 6 times a day. I drain, and that's it. I'm done with it. It works really well. I've traveled all over the world. I just got back from a little camping trip, and my Indiana pouch did what it was supposed to. It serves as a reservoir for my urine, and until I put a catheter in there to drain it, everything stays right where it's supposed to be. So with that said, if you're considering getting an Indiana pouch, it's really important that you choose the right surgeon or the right medical center. So I live in the suburbs of Los Angeles and San Diego, and when I got diagnosed with bladder cancer, my urologist, who is local to me right here, recommended that I actually go down to UCSD Medical Center, where they are doing bladder surgeries on a much more higher volume than her office was. She said, we could do this surgery, but they have a lot more experience down there than we do. And so I'm very grateful that she told me to go down to UCSD, because not only did I have a team of urologists to do the surgery, but as part of the surgery, I also had to get a radical hysterectomy. So there were gynecologists that were also there as part of the team of surgeons that did an 8 to 9 hour surgery for me. Again, everything worked really well because they have done multiple Indiana pouch surgeries and they know how to do them correctly. So the first thing that I would recommend to you is ask your surgeon or doctor who's planning on doing your surgery, how many Indiana pouch surgeries have they done? You certainly don't want to be their first patient. In fact, you want to see if your insurance is going to allow you to travel to the nearest university medical center to actually get with a team of urologists, and if you're a woman, possibly a team of gynecologists to do the surgery for you. So that's the first thing. How many surgeries have you done? You want to know. Number two, you're going to ask the question of your surgeon. And I know this sounds disrespectful when the time comes for you to ask the question, but you're actually testing the surgeon if they know what they're doing. Ask them, what valve do you plan to use when you do my Indiana pouch surgery? There is only one right answer, and that is the ileocecal valve. That is the one component and the secret sauce to an Indiana pouch that keeps it tight and keeps it from leaking. I'm part of two support groups on Facebook. We have over 300 Indiana pouch survivors or patients, you could call us, and we get a lot of new people coming in asking a lot of questions. Some of the questions of people who have recently had the surgery is, I'm leaking all the time. I can't stop the leaking. My doctor says it's normal. I'm here to tell you any leaking is not normal. And one of the women who was talking about the frequency of her leaking, I asked the question, did your surgeon use the ileocecal valve when he created your Indiana pouch? Her response was, no, he used a valve from my appendix. Well, it took me all of 30 seconds to put it into AI and ask the question, when creating an Indiana pouch, is using the valve located in the appendix as effective as using the ileocecal valve? And the response from AI was absolutely crystal clear, was that valve from the appendix would not create the anti-leaking capabilities of an Indiana pouch that an ileocecal valve will do. So I'm going to say it again. It's called the ileocecal valve. I invite you, if you're considering having an Indiana pouch, to ask the surgeon, what valve do you plan to use? The only right answer is ileocecal valve. So that's my 2 cents. I'm not a doctor. All I know is my Indiana pouch works fabulous. My surgeon did a great job, and I hope that your surgery goes as well as mine. Good luck. Stay healthy.